For any chronic diseases, even for the heart as well as for the brain, one of the important things is the lifestyle modifications. Our diet becomes important. Our sedentary lifestyle has become quite a risk factor for all of these diseases, and because of that, normally these are diseases of elderly, beyond 60-65 years. But these days, we are also commonly seeing this happen between 40 to 60 years, and one of the reasons for that is the sedentary lifestyle, and most of our jobs are also that way. Not having good dietary habits is one of the risk factor, and there could be certain habits in terms of the tobacco chewing, smoking. These also could add on as a risk factor. Hypertension again becomes an important risk factor. The higher the BP, again we have risk of both the hemorrhagic stroke as well as the ischemic stroke, cholesterol control, sugar control. All of these become very important. Obesity. These are common things which we see, which can affect every individual to develop a chronic disease, and our aim should also be to prevent such risk factors so that overall risk of stroke and heart attacks are reduced by this. One of the other important risk factors is the cardiac condition. Heart is directly related to brain. If the heart pumping ability is not adequate, means it is either pumping very fast or very slow, then also this stroke can happen, because it will throw the blood clots from the heart to the brain. And identifying such heart issues and treating particularly those heart issues also become important in prevention of stroke. So basically what we have tried to say is what basically is stroke, what are types of stroke which we encounter, how do we identify when a patient develops such stroke, and where the patient has to be taken once such symptoms are identified. And once the patient comes to a hospital, you have a stroke ready team which handles such situations. And first the patient goes into imaging, confirms the diagnosis of stroke. Time becomes important. There is because every minute we lose neurons or the nerves which are getting damaged, and you try to do specialized procedure first in terms of just giving an IV drug, and second in terms of taking them to cath lab and removing that clot which is blocking that artery, so that you re-establish the blood flow, so that you limit the disability which the patient would finally undergo. And quite a robust rehabilitation program is what is required later on from there. And obviously the strive is to prevent such diseases rather than to actually treat such diseases.